Hello, my name's Dr. Sarah Jarvis, and I'm here to talk about the latest guidance in relation to coronavirus, COVID-19 and pregnancy. Just very recently, the government announced that women who were pregnant were in an at-risk group, and clearly that's going to have been a concern. But we need to put this into perspective. There's no evidence that women who are pregnant are more likely to catch coronavirus. What we do know is that in a small proportion of women, being pregnant can affect the way your body reacts to having an infection. We see this with other viruses as well, such as the flu virus. So, even so, there's only a very small chance that you would become severely unwell. To put it into perspective, of almost 4,000 people who were ill enough with coronavirus to be admitted into intensive care units in the UK, only 10 were pregnant. But what does this mean for you and your pregnancy? Clearly, your maternity unit is going to want to take really careful steps to minimise the risk of you coming into contact with anybody else who has coronavirus. That does mean, for instance, that if you have a scan due, you should get in touch with your maternity unit. The same thing applies if you have an appointment. Your scan may well go ahead, but because of possible staff absences and so on, the time of it may be changed. If you're between appointments, wait to hear from your maternity unit. If you are asked by your maternity team to attend for an appointment, it's really important that you do so. Having regular checkups is essential for your health and the health of your baby. And if you're asked to attend, any risk to you will be smaller than the risk of not attending. Now, obviously it's important that you social distance really carefully. And that means staying away from other people as much as is possible, especially in the last 3 months of pregnancy. However, you don't need to shield, which means staying away pretty much from everybody and not leaving the house, unless you're pregnant and you also have significant heart disease, or unless, for instance, you have very severe asthma or you have cystic fibrosis. If you do develop symptoms of coronavirus during pregnancy, you can delay your antenatal appointment by up to 7 days, but of course, please do let your maternity staff know. And really importantly, if you develop symptoms close to labour, please, it's very important to contact your maternity unit and let them know. If you do want to find out more, you can look on the Royal College of Midwives website or the Royal College of Obs and Gynae website. That's the RCOG website. Lots more information on both of those.